March is National Nutrition Month as well as Women's History Month, so I'm going to be highlighting some key facts and information about women's health. A woman's nutritional need changes as their body changes throughout different stages of their lives. During teen years, women need more calcium, vitamin D, and iron. They also will need an increase in calories to support growing and developing bodies. After about age 25, a woman's resting metabolism goes down, and so there might need to be a gradual decrease in calories and an increase in physical health. Before and during pregnancy, a woman will need more of certain nutrients than usual to support their health and their baby's development. These nutrients include protein, calcium, iron, and folic acid. Folic acid is important because it helps prevent birth defects known as neural tube defects. Folate is important for healthy growth and development. The brain and spinal cord are formed during the first few weeks of pregnancy, but most women do not find out they're pregnant until 4 to 7 weeks. That is why it is important for all women of childbearing age who are pregnant or who are trying to become pregnant to take a folate supplement. During breastfeeding, women need to continue to eat healthy foods and they need to increase their water intake. Nursing women need about 13 cups of water a day. Breast milk has all the nutrients that your baby needs. It can help reduce their risk of infection as well as decrease your risk of diabetes, obesity, and other diseases. You will need about an extra 400 to 600 calories a day. Women who eat less than 1,800 calories a day have a lot of stress, anxiety, and fatigue can decrease milk production. Women will want to avoid or limit their caffeine, alcohol, smoking, or drug intake while pregnant and breastfeeding. After menopause, a woman will have a lower level of estrogen in their body. They will also have an increased risk for chronic diseases such as heart disease, stroke, diabetes, and osteoporosis. What you eat can affect those chronic diseases. An increase in calcium and vitamin D might be needed to protect your bones. A woman's reproductive system is a delicate and complex system in the body. It is important to take steps to protect it. Taking care of yourself and making healthy choices can help with this. Endometriosis is a problem affecting a woman's uterus. Tissue that normally lines the uterus will grow in other places such as on the ovaries, behind the uterus, on the bladder, or on the bowel. This misplaced tissue can cause pain and also infertility. Some will have no symptoms at all and won't know that they have endometriosis until they try to get pregnant. There is no known cause, and there's also no known cure, but can be treated effectively with drugs. Another problem affecting women's reproductive health is polycystic ovarian syndrome. This can happen when a woman's ovaries or adrenal gland produce more male hormones than normal. One result of this is that a cyst can develop on the ovaries. Women who are obese will have an increased risk of developing PCOS, and women with PCOS will have an increased risk of developing diabetes or heart disease. There is no known cure for PCOS, but you can manage your symptoms. You will need to talk with your doctor and work on a treatment plan based on your symptoms, your plans for having children, and your risk for long-term health problems. Research shows that diets high in unsaturated fat, vegetables, whole grains, and fish are associated with an increase in fertility, whereas diets high in saturated fat and sugars are associated with poor fertility. A BMI greater than 30 or less than 20 can also lead to poor fertility. Thank you so much for listening. Women's health is so important. There are many resources available online, including womenshealth.gov and the USDA MyPlate website.